The subcommittee will come to order. I believe the clock's a little slow, so we'll get started. And I want to start by mentioning we have a couple of distinguished alumni in the audience of this committee. Phil Gingrey, who is a member of our subcommittee, welcome. Very distinguished member. Mary Bonamac is here. Where's Mary? She often raised this issue with me, so welcome. We appreciate all of your interest and input as well. The Chair will recognize himself for an opening statement. Today's hearing will consider a number of proposals intended to address various aspects of our nation's drug abuse crisis. The Oversight and Investigation Subcommittee has held 5 hearings examining this public health epidemic and current efforts underway to combat prescription drug abuse. It is clear that despite these efforts, the epidemic has continued to grow exponentially. Today is a good opportunity to better understand what Congress can do to help. I appreciate the administration witnesses being here and working with us on these complicated issues. I also look forward to the testimony of outside experts on these various bills in the near future. Prescription drug abuse does not discriminate. It is not limited by geography, income, or age. According to the National Institute on Drug Abuse, 1 in 5 Americans has used prescription drugs for non-medical reasons. In 2011, the Substance Abuse and Mental Health Services Administration published a national survey on drug use and health and found that 1.7 million 12 to 25-year-olds abused prescription drugs for the first time, which amounts to more than 4,500 new initiates per day. These startling statistics should concern all of us. Unfortunately, only about 10% of people with substance abuse disorders will get any form of medical care. There are many of our constituents and their families that still need help, and I applaud my colleagues for working on legislation with that goal in mind. I now yield to the distinguished gentleman from Indiana, Dr. Bucshon.